Hi, I'm Daniel Hershey's Espelita, and today I'm going to perform the Fundal height measurement, Leopold's maneuver, and the fetal heart rate. Starting off with the fundal height measurement, it is used to determine the height of the fetus if it is appropriate in the age of gestation. So I've already washed my hands. Next is I'm going to gather the equipments that I will be needed in the procedure. So it is the tape measure. Next, I'm going to identify the client and explain the client procedure, provide privacy, place the client in supine position, and instruct the client to relax. Good afternoon, ma'am. I'm Daniel Hershey's Espelita. I'm your student nurse for today. May I know your name?
Hi, I'm Marge.
So good afternoon, Miss Marge. So I'm going to perform the fundal height measurement. It is used to determine the height of the fetus if it is appropriate for the age of gestation. So I'm going to expose your abdominal. Is it okay?
Okay.
Okay. So using the centimeter in your tape measure, I'm going to place it in the superior edge of the symphysis pubis of the client. So I'm going to bring it over the top of the abdominal, going to the fundus. So next is to take note of the measurement. So assuming that the client is in the 24th week of gestation, so the fundal height measurement is going to be the same, just like the age of gestation. So it will be also 24 centimeters. So after that, place the client in a comfortable position, document the findings and any unusual findings, and report it to the physician. So moving on to the next performance, the Leopold's maneuver. It is a 4 systematic steps in palpating the uterus through the abdomen to be able to determine the position and the presentation of the fetal inside the womb. So it is performed after 24 weeks of gestation when the fetal outline can be palpated. So assuming that I've already taken up the OB history, weight, the last menstrual period, and the age of gestation of the patient, now I'm going to proceed to the procedure. So, ma'am, you might want to go to the bathroom to void because you might feel uncomfortable in doing this next procedure. So after that, I'm going to place the client in a dorsal recumbent position. So I'm going to slightly flex your knees, and I'm going to place a pillow under your back. So after that, I'm going to show or expose your abdominal. Is that okay?
Okay.
So I'm going to warm my hands so that there will be no dancing of the abdominal muscle. So facing the client's face. So the first maneuver is the fundal grip. So it is used to identify the position of the fetal part in the fundus. So using both of my hands, I'm going to slightly press the fundus and feel for the fetal part. So the head should be felt round, hard, and it moves independently to the body, while the bridge is less well defined and it moves in conjugate within the body. So the next maneuver is the umbilical grip. So is used to identify the location of the fetal back. So using the left side of my hand, I'm going to support the uterus on this side, and the right side of my hand will feel from top to the lower side of the right side of the umbilic. And I'm going to gently apply deep pressure on this side. So the fetal back should be felt long and firm, while the extremities should be felt angular nodulations. After that is I'm going to do vice versa, so on this side. So the next, the third maneuver is the Pollock's grip. It is used to identify the engagement of the presenting part. So using my thumb and my index finger, I'm going to go to the lower abdominal, just above the symphysis pubis, and feel for the engagement. So it is engaged if it is not movable, and it is not engaged if it is movable. Or you can feel the movement. So after that, the last or the fourth maneuver is the pelvic grip. It is used to identify the degree of flexion of the fetal head. So just what I've done to the first maneuver, I'm going to do the same, but on the a part of the abdominal, just above the symphysis pubis. To the last performance, the fetal heart rate. So it is used to monitor and measure the heart rate and rhythm of the fetal or the baby. So again, I'm going to ask the client to void first, so that she won't feel uncomfortable, and place her on a supine position. So ma'am, do you want to void for you to won't get uncomfortable while doing the procedure? Okay ma'am, so if I'm the things I'm going to need is the stethoscope, and if you have the Doppler. So if you have a Doppler, you will have to lubricate it first, then listen for the heart tone, and after that is you're going to also count for the heart rate of the baby. So the average is 120 over 160 beats per minute. So just like doing the second maneuver, I'm going to feel for the fetal back of the baby, assuming that the fetal heart is in the right side. So in this part, I'm going to place the bell of my stethoscope on the back side of, or the fetal back of the baby. Count for 1 full minute for the heart rate, and listen for the heart tone. So after doing that, I'm going to disinfect the things that I use, and also do hand washing. So after that, document and note any unusual findings to the physician. Thank you.